Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section we discuss about foods and beverages as one of the 6 essentials. From the previous sections you remember that there are 6 essentials for maintaining health and bringing it back if there is an illness. These 6 essentials included air or environment, foods and beverages, of course, sleep and wakefulness, movement and stillness, expulsion and retention, and at last the disturbators of the mind or psychic factors. Between these 6 essentials, most powerful in long term is the air, but using it for management a disease sometimes is expensive. If you ask a patient to move or immigrate to a new area with proper climate, it sometimes costs a fortune for the patient. Another strong essential or strongest essential in short term is disturbators of the minds. But using psychic factors for treatment of a disease needs a high level experience and ability of theatrical act, a proper knowledge of psychology, and sometimes ignoring morality. So, in Iranian traditional medicine, mostly healers try to use less expensive and available essentials for management of disease or maintaining the health. One of these available and less expensive factors is foods and beverages. From the previous sections you learned that there are some temperamental or medicinal foods, a classification based on temperament of the foods and of course medicines. We use cold temperament foods for treating warm temperament disease. We use warm temperamental food for treatment of cold disease or cold distemperaments. Also, the same as for dry or wet foods. There are some food with mixed temperaments. Some foods are dry and warm, some foods are dry and cold, some foods are wet and warm, and some foods are wet and cold. You can see and be familiar with this food on description area under the video of temperamental foods. For example, letus as a cold and wet temperamental food is used for treating of the fevers and of course warm and dry distemperament. Sometimes we use a temperamental food for maintaining an intrinsic temperament. If you remember, We use milk as a watery, warm and wet temperamental food for maintaining the intrinsic or the age-related temperament of a newborn baby with warm and wet temperament. This baby needs milk because milk has the same density, the same similar density, and of course the same temperament that a newborn has. There are another classification of the foods for different use in treatment or maintaining health. In this section, I will mention the one of classifications based on difficulty or easy digestion, and the amount and of course the quality of chymos, that is combination of 4 humors. 4 humors, I mean sanguine, choleric or yellow bile, melancholic or black bile, and of course phlegm. Their combinations, which produced by the liver, is called chymos. So one of 3 main group of this classification is related to chymos. Health chymos, healthy chymos, or bad chymos. Actually, this group has 2 subgroups. Foods are healthy chymos or produce healthy chymos, or bad chymos. All of the foods can be classified under these 2 subgroups. Another group in this classification is nutritional foods, moderate nutritional foods, and little nutritional foods. This group has 3 subgroups. All of the foods can be classified under these 3 subgroups. And nutritional foods produce large amount of sanguine humor, because the sanguine humor is the most absorbable humor by the body that will replace to the what is lost from the body. Sanguine humor is the main final food of the cells. And little nutritional food, of course, is a food, for example, like lettuce, like apple, like pomegrenade, that produce less or little amount of sanguine humor. This sanguine humor may be normal or may be abnormal, may be in proper proportion with other 3 humors, or may be unbalanced with other humors. These are the previous group: good chymos or healthy chymos against bad chymos. A bad chymos group has a non-beneficial proportion of 4 humors. They are imbalanced. The final consequence of a bad chymos food is a bad organ or unhealthy organ. So why we eat these bad chymos and how we eat them? We eat them by correctors or using a special cooking techniques or special spices for bring the balance to these foods. So we make them a proper mix or cooked food to can consume it, because the healthy chymos food are rare and sometimes expensive. We have a few healthy chymos food that we can eat them singularly, like bread or lamb meat, or figs as a fruit, or grape as a fruit, or wine. They are rare. There are some limited food. So we have to use other kinds of foods, but we correct them for consumption. The third group of this classification has three subgroups also. The fine foods with easy digestion, and of course loose humors, mostly loose sanguine humors, that lead to a loose body if we chronically use these fine foods. But why we use these fine foods? Because sometimes we have weak digestion system. Weak digestion system cannot take other subgroups of this group, I mean moderate, between fine and thick foods. Thick foods has a difficult digestion and are proper for a very healthy, hard worker or athletic young person. Of course, this thick food leads to a very thick sanguine humor or blood humor that leads to a very compact and strong muscle production. The foods singularly, each food can classified under all these three groups. I mean healthy bad chymos, fine thick group, and nutritional less or well nutritional. So by combining two subgroup in the first group and 6 subgroup in the next two other groups and multiply them, we can classify all of the foods under 18 divided house in a table. Actually, imagine a table with 18 house. Each group, each food can be in one of them. I bring some example for each of groups. You can click on description button and see them. As a practice, draw an 18 house table for yourself and try to classify each food in a house of this table. For a patient in recovery time, for example, we used healthy chymos, fine and nutritional food.